The Public Health Agency of Canada says the country has entered a flu epidemic. The agency says the rate nearly doubled in 1 week to 11.7% between October 30th and November 5th. Now, this is compared to 6.3% the week before. The surge in flu cases comes as Canada's healthcare system grapples with a triple threat of respiratory viruses: COVID-19, influenza, and respiratory syncytial virus. And some experts warn that the surge of respiratory illnesses in the country will continue to worsen. Well, joining us now to give us the latest on this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Great to be here.
So, as we mentioned, Canada is now in a flu epidemic. What exactly does that mean, Dr. Raut?
Right. So the Public Health Agency of Canada declared an epidemic, which most years means they'll declare it after a threshold of about 5% positivity rate is surpassed. Obviously, this year we've seen almost 12%. So certainly we're looking at much higher levels than expected with even pre-pandemic years. What we're seeing as well is 13 confirmed influenza outbreaks in just the first week of the month, including 9 in long-term care homes and 1 in a school and daycare as well.
Now, considering that this is coming following the peak of the COVID-19 pandemic, how is the medical system handling all of this amid staffing shortages?
Well, I think it's fair to say that bowel movements continue to hit ventilators. I think what we're seeing at McMaster Children's Hospital is nearly a 140% capacity and a daily average of almost 200 patients per day in the emergency department. So what we're seeing in McMaster and many other places is just a very difficult time in healthcare where we're having a large capacity of patients coming in and it's difficult to handle.
Very concerning information there. Now, what do you think contributed to this rise in respiratory viruses just when we thought that we were out of our or are on our way out of the pandemic?
I think that's a very good question. We know these types of viruses, RSV and influenza, they tend to thrive in these dry, cold conditions. And what we do know is these colder conditions tend to make our bodies respond to disease and make us behave differently as well. We spend more time indoors, and indoors it can be a bit drier as well. And remember, these viruses enter through the mucus and our noses. So when it's more dry, we just don't have that barrier protecting us. So it makes it easier for viruses to infect our bodies.
All right, Dr. Rao. Well, we mentioned some experts are saying things are only going to be getting worse. How do you expect this triple virus threat to impact Canadians in the upcoming holiday season?
Right. So not surprisingly, last year we saw a very high number of people experiencing the COVID-19 Omicron variant. I think this year we're going to see something very similar with different viruses. Also, keep in mind, we're going to see a lot more travel and gathering in the holidays as well. And the issue that I see here is that this is a triple threat. Last year, we could at least test for COVID-19, but we can't really test for RSV and influenza before going to a gathering. So I think the best thing to do here is just being sensible with those gatherings and trying to make them smaller when possible.
Important points to consider there. Now, what does this flu epidemic mean for the pandemic, considering that we've left the emergency phase of the pandemic?
I think when we look at it, every epidemic has its toll on our healthcare system and on us, whether it's ICU beds, healthcare provider shortages, or even caregiver fatigue. So even though we've left the emergency phase of one pandemic, having these other epidemics converge together is definitely not an ideal situation for anyone, and I think it leaves us very vulnerable.
Not ideal indeed. Now, something interesting to mention is that Moderna is coming up with a three-in-one vaccine for COVID, RSV, and the flu. What do we know so far about this, Dr. Rout?
Right. So at least a little bit of good news. So Moderna is promoting this COVID-19 flu and RSV vaccine, and we're hoping it'll take care of all of them. The only issue right now is we don't really have much data. So Moderna hasn't really released data to support the safety or efficacy. And without seeing these large phase 3 clinical trials, I don't think we're going to see much from the vaccine yet. And we probably won't see any approval from Health Canada anytime soon until we have that data.
All right, Dr. A quick 45 seconds left here, but we're also seeing masking being recommended again in some places. What other steps would you recommend officials to take amid these viruses?
Yeah, I think what we're seeing here is, hospitals are going to continue to remain pretty overcrowded with patients there. So we've got to look at options to bring this down. I think masking indoors is a very sensible thing to do at this point here. I think it's also important to look at what the key demographics are that are especially at high risk and ensuring that they have their services so that they don't have to venture outside as well.
All right, Dr. Raut, always great having you on Forum Daily. Thanks again for your time today.
Hey, thanks so much for having me.
Stay with us. We'll be right back after the break with a look at the state of surveillance in the Arctic. The Auditor General's latest report finds the federal government doesn't have a clear picture of traffic in the region, and that is concerning as the region opens up amid the effects of climate change. We'll have that interview up next.